Welcome back. In today's Health Watch, a lot of people take daily fish oil supplements. They're known as an excellent source of heart-healthy omega-3 fatty acids. Nearly a quarter of adults over the age of 60 in the U.S. frequently use these supplements as a way to support heart health. However, a new study finds regular use of fish oil supplements may increase, not reduce, the risk of stroke and atrial fibrillation for people in good cardiovascular health. Fox Medical Team's Dr. Mike joining us now this morning. Dr. Mike, pretty surprising information because, as we just said, a lot of people take fish oil supplements thinking they're doing something good for their heart. So tell us about this new study and the risks.
Well, basically, they looked at over 400,000 patients, and they found that people with no history of heart disease, good heart condition, actually increase their risk of atrial fibrillation and first-time stroke. Now, the theory is that fish oil can affect negatively the electrical circuits in the heart. So I brought a heart right here, all right, Pam, and basically fish oil can have some negative effects leading to something called atrial fibrillation. That's where the top of the heart fibrillates, the atria, and it doesn't contract properly, and that can lead to an increased risk of stroke. Now, that being said, if you have underlying heart disease, the study found a reduction in atrial fibrillation and stroke and heart attack. Now, what I do in my own practice, and by the way, I take 1 fish oil a day to lower my triglycerides. Now, not to give too much information, I have a tiny little bit of plaque in one of my coronaries, and so I'm being very aggressive with myself. However, the thing is that, one, it's dose related. If you take more fish oil, the higher the risk. And you want to be careful about over-the-counter fish oil products. Some of them are quite good and pure. Others, maybe not. And so, at least in my practice, I use prescription fish oil when I'm trying to lower those triglycerides.
Oh, so not something, a prescription, as opposed to just grabbing some of the fish oil. There's so many in every drugstore, basically.
Well, I like to get something where they have a lot to lose if they screw up. And so basically, pharmaceutical grade fish oil, you can rest assured is pure, and you want to make sure that you talk with your healthcare provider to get the right regimen for you and to see whether or not you're a candidate for fish oil. What I do, and I recommend to a lot of patients that don't have heart disease or high triglycerides, how about wild-caught salmon? A couple times a week. A little bit of lemon juice and some pepper. To die for. You'll love it. Love it.
Definitely, I'm a big fan of salmon. All right, that's an easier way to handle all of this. Dr. Mike, thank you so much for that information.
Thanks for having me, Pam. You're the best.
Stay heart healthy.